October 12th, sorry. And we're happy you're all here. We'll move through our agenda. The first item is review and signatures for the September 2022 Board of Health meeting. Everyone, I think, has seen and approved. Every motion to approve?
I make that motion.
I'll second that motion.
All in favor?
Aye.
Okay. COVID-19 updates. I will start and just say that as of today in the UMass Memorial System, there are 114 patients who are COVID positive. That doesn't necessarily mean that's the reason they were admitted, but that's the largest number in the last month. And the Blackstone sewage quantitative RNA indicates that we're running still around 1.5 million copies per liter. So, and I know, as probably many of you know, many people who have had COVID in the last few weeks. So BA4 and 5 is still in circulation. And again, I think most people have had relatively either asymptomatic or relatively mild illnesses, especially if they've been fully immunized. And I would encourage everyone to really think, if you haven't received the most recent booster, you should get that booster. Contains the original Wuhan strain as well as the BA4-5 mutant strain. So please go ahead and get your booster. And other comments on COVID?
I have a question. What if somebody got the initial vaccinations late and hasn't gotten the first 2 boosters? Should they get the most recent booster and skip the other 2?
Yes,
Okay,
because the most recent booster contains the original strain. And
all right.
any other questions or comments? Okay, our next agenda item is we'll have our Alliance update. Julie?
So I'll give you what I have today, just from some of the that were conducted here in this town. Miku, Walmart, the Mill, the Major Edwards Elementary, the Middle High School, Live Love Nutrition. I reviewed food renewal applications and approved some applications for Maggie, as well as a mobile food truck that is going to be coming to an event here sometime soon. I think it was October 22 or something.
Yep.
22?
Yeah, it's the
22.
fall festival.
Fall festival, yeah.
Okay, and then I also reviewed installers, applications, and approved and signed permits. I've also reviewed tattoo practitioner applications and approved some new practitioners that are going to be coming through this area. Also, Micah and I both reviewed the packet for Bamboo Garden. They're going to add in a sushi bar. I was able to review the packet in its entirety yesterday, as well as the interior drawing. So I just need to see the interior layout, and I have approved that as well, pending plumbing. I think plumbing had to do an inspection, the plumbing inspector there.
That's all set up, that's being set up, yeah.
Okay. Also a complaint on 98 Shrewsbury Street and 33 Prescott. I did soil testing for a system upgrade, and we'll be getting a plan at some point from Cornerstone. The house is vacant.
What was the complaint at 98 Shrewsbury?
A concern with rats. Do you have any questions for me?
I do. The manor I saw was going to be leased. Do they have to refile any more permits, or?
So if it's, this was with Pinecroft as well, if there is a new owner, the food permits do not transfer. So the new owners, whoever is operating the business, they need to come apply with the Board of Health.
Okay.
Because it's
So-
a different EIN number, different, insurance. Again, I'm sure that they would have to, I would think, go back, to the
They
Board of Selectmen.
necessarily
comment
know
back-
that, or should we, since it's been publicly stated that they've applied for a change in the
Yeah, I think
in the
that,
alcohol and liquor license, maybe it would be worthwhile letting them know they have to get a new
food
permit.
permit, yeah.
Yeah, we did get one from the folks that are taking over the,
Pinecroft.
Pinecroft, but I haven't heard anything from the folks that are supposed to be taking over the manor. They did call to inquire about something, but I haven't heard any, I haven't gotten an application or anything, they haven't asked about doing it yet. So I don't know if that transfer has been done yet, so.
So my question to the board would be, renewals have been sent out for the restaurants, because they expire at the end of December. If the new owners of the businesses come apply with the Board of Health for their new license, would it be okay, to extend it to the end of next year, or do you want them to reapply in 2 months?
What
Oh,
would
mean
you
on-
recommend?
Like the manor that just
Correct.
she transferred. In other words, that they'd have to have a permit that was only worthwhile for, pay the fees for 2 months and then, and in January renew.
Right.
And then have to
We
pay for
don't
the 40.
prorate though.
So we don't prorate, but would it be, so that's what you want them to do, you want them to pay for the 2 months and then pay
I'm
again?
not-
Or would you, because the renewals have already gone out and I'm already approving the new permits, would it be okay to put it in effect from the date I sign to the end of the
Next
permitting
year.
year?
Yeah, that's what I would do.
Okay.
I
Bob
would
has done
recommend.
that before, so.
Everybody in
wanna
favor of
record.
that?
Yeah.
We have a motion?
Motion is a motion.
Second?
All in favor? Aye.
All right.
So how many months, can I get that clarified? Normally that doesn't usually happen until.
So there's really no clarification, you sent out the renewals, people are already renewing, right?
Right.
So if we get all their packets in,
Okay.
it's
so
gonna
the-
be
the
good to
new
the end of
owner-
next year.
Okay,
Yeah.
all right, okay. If people are renewing within the end of the year period,
Yep.
after they get their
Correct.
thing,
Mhm.
okay.
Good.
Anything else? Jim?
Okay, Maggie, your office report?
Okay. Sorry, I've got little kid, things on my mind. Have you ever seen Creature Report? Okay. No, anyway. All right, so there's not a whole lot of changes going on since the last report for septic updates. Everything sort of seems to be in limbo at this point for those who reported that they were upgrading the system. I haven't had any progress on any of them. 33 Prescott, as Julie said, she just did soil tests, I didn't even have that on my list. There were no recent Title V inspections completed. Julie's waiting to hear back on the issue with the tank that we don't know the condition of at 104 Shrine, which we didn't have any abandonment paperwork on, but they were hooked up to sewer. I just wanted to, there's 138 permits to date for 2022. And we're getting them in, because I've sent them out via email, I've sent out the renewals via email. I'm kind of getting things set up so that eventually Faye would like to put our applications online on the website. And so I'm taking all I usually have them dated for the year, so I've kind of taken those dates off and put in more general guidelines. So those are being done, and then eventually hopefully for next year, they'll be online so anybody can access them. So that's something I've been working on. I have some other updates to do for all the permits, because the logo for the Central Mass Regional Public Health Alliance changed, and I haven't been able to get all of the paperwork, the logo switched over for all the paperwork. So 2022, 138 permits are in to date, and there are 10 approved so far for 2023, but I've probably got at least five on my desk that just came in today, and not yet processed. And Tees Deli everything was approved by the building department and us, and their permit was issued. And just so you know, they're gonna be doing mostly catering, but he's also gonna be having a little counter where he offers prepackaged, meals that he prepares there that people can buy. Nothing new on tobacco violations. We had bill approvals for the Worcester IMA. Both came in since the last meeting for August and September. Sutton Board of Health Nursing Services, their regular fee, and we still are, being billed for COVID, and we do no longer have funding for that. I did inquire, in Worcester if they got any, more funding for COVID services like that, and, from what I understand, they haven't. We also we renewed our, the Massachusetts Health Board membership fee for 2023. So, I think that's it. Is there anything I'm missing here? Nothing, I don't think there's anything else for that I have to report.
Good.
So I think we're all set.
Any new business that people want to bring up?
At your request, Mr. Chairman, I attended that roundtable for the proposed 40B that's gonna be at 18 Malden Street, and frankly, there was no information. There's nothing to report. We don't know if it's actually
Short
gonna
meeting,
happen. Yeah, well, it went on, but there was no new information. We don't know if it's gonna be a 40B. We're not sure what the status is of it and that. So that's about all I got to offer on that. So that's it.
Okay. November meeting? Do you want to set a date? The second, what is the second?
The second's on a Wednesday.
The second Wednesday is the 9th. So the first Wednesday is the second, and the second Wednesday is the 9th.
So how's everybody for the 9th?
I think I have something on the 9th.
I do too.
I have it listed as Board of Health, yeah, okay.
So,
You're saying you have something?
I
Yeah.
have something that,
can we
You
do
have
it
a
the third?
conflict,
Third
right?
Wednesday?
I
16th?
believe so. Yeah,
Yeah.
the 16th is
Good.
good.
I will not be here on the 16th.
Okay,
Oh,
let me
all right.
just, let me
So
look, hold on.
We don't wanna go too much further than that.
why don't we do it on the 30th?
Okay.
The 30th of November?
Yes, that's the last Wednesday.
Can everybody do that?
Sure, then we could do for 2 months. Perfect.
Okay, the 30th.
All right,
Okay,
so let's,
11:30.
November 30th is the,
Next date.
Next,
is
Board
the
of
date,
Health.
and you can just make sure everyone can attend.
Yeah, I'll send an email out
Okay.
and say that was proposed and
6 p.m.
because people are not available for the other 2 days.
Okay,
Yeah,
perfect.
Perfect.
Motion to adjourn?
I
So
make a
moved.
motion to adjourn.
Second?
Second.
Okay, Tracy?
All in favor? Aye.
Okay.